Hey everybody, welcome to another episode of The Executive. So excited to be joined by Kevin McGarvey of Hippo Health,
Thank you, Matt.
health tech platform that's connecting physicians and patients through virtual care, which is really amazing. So good to have you here today.
Great to be here, Matt. Thanks for having me on.
So what I found was so interesting about your company is you started in 2019, so you were ahead of your time before COVID happened and everything went virtual. So clearly you saw a need for this in 19 when probably not everyone
Yes.
else did. So tell me about that story and how everything came to fruition.
Absolutely, yeah. So as an emergency physician, I felt the modern day care experience was broken, in large part due to lack of easy communication between not just patients and providers, but in between care teams for better care coordination for patients. Working in the emergency department, just saw patient after patient that would land on our doorstep that didn't really need to be there if the right providers had been able to just talk to each other for a couple of minutes to help solve that patient's problems. And so after my medical group got acquired and after our team had worked on a number of telemedicine platforms, we decided to start our own company that we thought would meet a need in the market for the ability to better connect patients with the right providers at the right time for better care. And with working on a number of telehealth platforms, we found that it was really challenging to be able to talk to our own colleagues as clinicians in local communities for that last mile of care and being able to refer a patient and coordinate care. So we built a platform that enabled not just patient-to-provider communication, but also provider-to-provider communication. And we launched it here in Colorado in 2019, before COVID.
Yeah.
And then after having about 25% paid user growth month over month for the first few months, we had COVID hit, and we had about 1,200% paid user growth in 2 weeks.
Wow.
So went from just a handful of visits happening on the platform to, I think we had 14,000 visits a month when COVID was first unfolding. And so, yeah, it was definitely quite a ride during that change in the whole world.
Yeah,
So,
went virtual.
yeah.
And so, you take COVID out of the equation. Is a big challenge then that, 20 or whatever percentage of patients just truly don't need to go in to the hospital for either emergency care and they could just be diagnosed over the phone pretty easily?
Yeah, I think that was a lot of our initial hypothesis was that if there was better communication happening, again, kind of getting that patient to the right care source, that patient wouldn't need such a high level or high cost of care that happes in the hospital.
Got it. So they're going to the wrong person too, and they're just not at the right
Yeah, they just
care
don't
center.
know. I mean, healthcare can be pretty opaque, and it's probably more along the lines of 60% of patients going to the emergency department could be treated in the outpatient setting, given the right care coordination and communication flows. So
Interesting.
Yeah.
And so you're creating a marketplace, right? So you're building out the physician piece as well as all the patients. Really hard to create at the same time.
it is, yeah. It's definitely a challenge doing the two-sided marketplace, and obviously, COVID catalyzed a ton for us. We, simultaneously had rapid growth. We also had a lot of players just enter the market, like Zoom Healthcare, Doxy.me, number of platforms. And so now we're basically focused on several niche verticals within healthcare that can have complementary sort of synergies between each other. And so we've built out more of the technology around not just clinic-based telemedicine, but also more recently ambulance-based or EMS-based telehealth. And then June 1, we just brought on a new CEO, Eric Orm, that's helped scale a couple of health tech companies from about our stage to 100 million, and is an expert and 100 times better than me in sales and marketing. So we're expanding our strategy, and so really excited for kind of the next 9 months as we roll out into several new verticals.
That's really interesting. So you brought in a new CEO, and you're taking almost you're stepping into a new role.
Yep.
What's that like as a founder to make that decision?
Yeah, it's funny. It's been really great for me. I think it's something where I've learned a ton over the last few years as a founder and CEO, and I think we've built a really great product and a lot of great use cases, but also knowing what I'm good at and what I'm not good at, bringing in someone that can really complement some of my weaknesses around, as an emergency physician. I understand the clinical use cases, but I've not scaled companies. Eric has, and so I just feel so blessed and grateful to have him on board for kind of this next stage of growth for the business. So.
Yeah, and so your focus going forward is going to be into kind of product market fit, or what would you say your priorities would be?
So it'll be with being the product owner, basically, chief product officer for the platform, and then just helping with fundraising, all the other hats as well. So.
Right, there's a lot of hats. As as the founder, what has been surprising about this journey? Either what that was you didn't expect to be so hard, or it would have been really helpful to had someone told you some advice early on. What's been surprising to you on the journey?
What surprised me? It's definitely been a challenge for my own wellness and balance. With my work and career prior to doing a startup, even though emergency medicine's very stressful at times, you can kind of turn the pager off and step away and recharge. And I think with the startup and how we've invested into the business, it's been 24/7, and so being able to compartmentalize, I think, is something that I wish I had known how to do a better job of. And then, at each phase of the business, we brought people in, and I think, we're at this stage right now where I'm just really excited to have a partner and visionary to work with, like Eric. So,
were you a solo founder then?
So it was founded by a group of physicians, actually, and then we spun it out of the medical group when my medical group got acquired. So I think our original founding physician team was like 30 emergency physicians.
That's a lot of opinions.
A lot of opinions.
Yeah, where you need to strike that balance, right? Where you have someone to lean on, ask advice for, and bounce ideas off, but not have too many cooks in the kitchen, probably.
Yes, yeah. So it's definitely been a learning experience coming from what we called a democratic emergency physician group, where it's a lot of cooks in the kitchen, to more of the kind of the efficient startup decision-making process. So.
And as you grow this marketplace, that it's really obvious as a consumer to be like, yeah, that'd be really nice just to go on the app and get help immediately and not have to go somewhere, right? But for the physicians, what is the real value add for them? Are they doing this full time? Are they behind a Zoom screen per se, like for the whole day, or how does it work on their end?
So one thing we've seen just with COVID is healthcare providers around the country have just been hammered with having to deliver care in a way that's really taxing and stressful at times. So there's actually, I think, a lot of physicians and care professionals that are looking for new ways to deliver care, and ways where they can be working from home, be able to help people and deliver in a way that they're making a good income, but also they're not as in kind of the stressful trenches of an emergency department or a hospital day in, day out. So we think that our model can help strike kind of a healthy balance for a lot of care professionals that are looking to deliver care in a new way, an innovative way, but also not bear the burden and stress of the traditional system. So.
And then are a lot of your customers also insurance companies that you're benefiting because that person doesn't go to the ER that didn't need to, and they didn't have to incur that expense? Is that customers too?
Yeah, so our model is really a B to B to C model. So we provide the software to the care professionals, and then they will be billing the insurance plans. Over time, we might be doing more direct-to-payer relationships for population health, but the model we're in right now is really serving the providers in local markets that want to deliver kind of a new form of care and create new revenue streams for their practices.
And where do you know, virtual care is, I don't know if I would say it's relatively new, but maybe it's become more accepted in the last 2-3 years. Mm-hmm. Where do you see virtual care going? Where can Hippo Health? What's your vision for Hippo Health?
Yeah, I think now that most everyone has had an experience of getting virtual care, and we've had ebbs and flows with the utilization of telemedicine and different specialties and different levels of care. We have a platform that is excellent with the care coordination and referral piece. So we're focused on niches of healthcare that really haven't been fully capitalized with telemedicine in this sort of way. So essentially, we think we can start to address patients that are having more complicated medical issues, mm-hmm. more sort of intermediate acuity medical issues rather than just low acuity issues.
Yeah.
So as an example, we're taking care of patients that are elderly with end-stage kidney failure or COVID pneumonia, congestive heart failure, patients that are intermittently suicidal or anxious, and being able to really deliver a deeper level of care in some of these niche spaces. So we have really 6 verticals that we're going to focus on in the next year, and being able to really have overlap between those verticals for referrals will allow us to go deeper, if that makes sense, in the level of care.
And does it get to the point where you become someone's primary care, like the virtual, like that is Hippo Health is your primary care?
We would just provide the software, but there could be users on the platform, and there are users on the platform that are pure primary care physicians, yes.
Okay.
But then ultimately, those providers will likely provide some care in person and some care virtually, just depending on the needs and the workflows.
Which now, because you don't want to go somewhere, right? Like a lot of times you probably don't go as often as you should to your primary physician, and that could change that, right? Where it's so easy to talk to them on a regular basis, and then maybe it becomes more preventative care.
Yes, yeah, that's right. Yeah. So, we're looking at a number of different ways to deploy the system that'll, we think, help engage patients in a better, healthier way than you might see if a patient's just, like you said, going to a bricks and mortar clinic for all of their care. Yeah. So.
And because we're at the Colorado Venture Summit, I have to ask a question about that. What, obviously the Venture Summit is connecting founders and entrepreneurs with investors. Why come to this event for you guys, and how has everything going on in the world affected your conversations with investors?
Yeah, this is the first time I've been to the summit, and I gotta say it's been really, really great format. Hats off to the organizers. I think Colorado's great in the way that the people that tend to show up for these sorts of events really want to help each other, and things are without many barriers. So we're currently, raising about $250K, mainly from angels right now, and then looking to raise about $2 million by the end of the year, to really help scale our model across the country. So.
And so you're having conversations with investors that are probably going to be hopefully the A, but trying to get ahead of that here.
Exactly.
Yeah. That's awesome.
Yeah.
Well, as someone who's now been a founder and is now transitioning the role as well, what advice would you have for other founders that you would have loved to have had at that time when you were starting?
Yeah, I think recognizing your strengths and your weaknesses, and then surrounding yourself with team members that can complement those strengths and weaknesses, as well as just being open to new opportunities. There's, I think, a fine balance between having a vision and then listening to the market, finding the product market fit, as well as scaling a business in a competitive, high-risk environment, being able to pivot as well as bring in leadership that can help take things to the next level. So
on product market fit, how hard is it, and how do you avoid this of pivoting too much, where you see something work and you go all in and you realize it was maybe too early for that, right? How do you balance constantly changing your product to a lot of shiny objects?
That's a great question. I think finding that product market fit where the user is delighted with the experience and something that you can then replicate and scale. With our product and with the state of the telemedicine industry and how we finance things with mainly bootstrapping to date, I think we are coming into finally kind of the product market fitting with the original vision of care coordination between multiple teams. So our journey has definitely been one of several pivots, and I think the story, the ending of the book's not written yet, so I'll let you know if that's the right strategy or the wrong, maybe a year or two from now. So
yeah, that's awesome.
Yeah.
I'd love to end with, if you have a favorite book, either about entrepreneurship or just in life in general, that you definitely would recommend for others to read.
Oh boy, geez. I guess I'll go with a classic one. So it's a classic one where it was written about older, sort of large businesses, Good to Great. If you know Jim Collins, he's just again luckily become a friend and mentor to me over the years. He lives up in Boulder, and I think that is a classic text I always like to come back to, and definitely shaped a lot of my passions and motivations over the years. So
it's a great book. I didn't realize Jim lived in Boulder, so now the secret's out. So I'll probably get a lot of reach outs for coffee now.
Yeah, right.
Well, Kevin, thanks so much.
Yeah.
Really exciting
Matt,
what you're
thank
building
you.
at Hippo Health. Appreciate you being on.
Thanks for having me on.
Absolutely.